any patient that is seen in the Crozer-Keystone system emergency room has access to the Navigator program through the emergency room with no extra added fees, anything like that. It's all through physician referral. They come in and they're not feeling well, and they're told to follow up with someone, but sometimes the anxiety of it and the stress of it, can really be confusing and overwhelming for a patient.
They like the fact that they don't have to make their own appointments. They know that having something scheduled for them is less of a heartache for them, especially if they don't know the doctors in the area. We help familiarize them with what they can choose from.
It can be very intimidating and scary when you come to the emergency room with a problem, and when you're discharged, you may or may not know where to turn. It's reassuring for the patients to know when they're discharged from the emergency room that the contact with the hospital doesn't end there, that there's someone willing to help set up that follow-up care if necessary.
Patients assume that when they come to the ER, everything is going to be cured when they're here, and we let them know that it's emergency basis. We make sure nothing is life-threatening, and that you do need to follow up with a specialist who specializes in that area. So if they have a broken bone or a neurological issue, we refer them to the proper doctor so they can get further care at that point, and it helps bridge the gap so they don't end up back into the ER.
It's great for the patients to have that sense of relief, knowing that they're not alone, in the process of getting good follow-up care in the system.
I like having the patient come back and say how much they appreciate the program, and being able to make someone's life easier makes it all worthwhile.